So this is the art of hair transplant restoration surgery result, and this client, I mean, you know, one of the greatest satisfaction of my job is to a year later and to see that I have from my work of art and really transform a person's face and a person's life actually, because it's really brought back his handsome look, his youth, but brought it the guy that he lost when he lost his hair and all his self-esteem and his personality. And you know, he told me it really touched him, it really affected him when he lose hair. It's a difficult and long journey, but once surgery is done and doing the recovery and all this stuff, it's totally worth it for him now. He's a completely different person. And again, he's back where he was, and look at how excellent density and natural it is right now. And I'll show you what he was. That was him. A very advanced hair loss pattern. You know, medicine will not get you this kind from here and all the way to the back. You know, you need surgery. Medicine is good for maintenance, and I recommend medicine for patient, but not all my patients take the medicine. Every surgeon will recommend medicine for maintenance after surgery, hair transplant surgery, but only 25%, unfortunately 25% of my patients take the medicine or apply medicine. But this is where he was, and that's where he is now. But so let's start from the beginning, okay? So we want to show the patient right here. So, you know, when he lost quite a bit significant hair loss like this, it really affected him. And when you lose hair and you lose your hairline, you lost the framing, and then you end up look older. And you know, and affect people in many different ways. Some people just wear a hat, some people avoid photos, some people don't want to go shop, you know, don't want to take pictures, don't want to go swimming. It really affects their how they live their life. But once you do it right, and you will really bring back a person's life. And as long you know, pay attention to the artistry, the hairline, you will give him the most natural hairline, and you want to be able to sit in front of people and feel confident that no one knows you have had surgery done. And that's what I always strive for, because density is given with my work, but artistry, that's the most difficult, and not every surgeon is an artist. And so when you do research, you want to pay careful attention to the artistry of the hairline. For this client, we lower the hairline, we brought both temple as well. Temple is very difficult, and a lot of surgeons don't want to do the temple. You see the forehead smaller, the hairline dip down, slightly curved on both sides. But look at the temple, and you see it brought in very natural. And I'm one of the few surgeons not only specialized in advanced hair loss, but specialized on the temple as well. And we're gonna look in the front. You see how significant hair loss. And if we don't bring the temple, he have a really wide forehead. But we want to make sure the temple is brought in, and you see how natural that is. And we lower the hairline, you see how bald back, and slightly curved, and then temple have nice and good flow to it. And you see how natural the temple is. Excellent curve, excellent density. Again, we want to make sure this is filled in, slightly curved. Look at that. But the top view, and you see that's where he was. And you know, medicine will not get you this to this. You need surgery. But medicine will be helpful. And medicine, if you notice, it will, you know, it helps good for maintenance. And that's what I recommend for most of my patients. And this is where he is now. Look at that. Very natural, very dense. And go ahead, look up at me. Turn to the right. Perfect. Turn to the left. Look straight at me. And this is the art of hair transplant restoration surgery result. 1 year post-op with before and after photo. And this is where he was. And this is the handsome guy here. Thank you.